Hello friends, so we were talking about immunology from the first aid, and today's topic is about the spleen. So spleen has two pulp, one is the white pulp and the next is the red pulp. White pulp is for the WBCs, W for white and W for WBCs, and they're responsible for fighting infections. Whereas R is for red and R is for RBCs, and RBCs act as a blood filter. So in the red pulp, there are sinusoids, there are reticular fibers, and pulp veins. The sinusoids are actually the spaces, and the reticular fibers are actually the supporting network, whereas the pulp veins drain, the blood drains out from the hair. So if we go from the inside to the outside of the spleen, the most interior structure is the artery, and then after the artery there is a T cells that we call as a periarterial lymphoid sheath, that we can remember by the word pulse. So pulse is the periarterial lymphoid sheath that surrounds the artery. And after the T cells, there are the B cells that have the follicle, the germinal center, and the ring that is present around the germinal center is the mental zone. And the last layer, the outermost layer, is the marginal zone that composed of macrophages and specialized B cells. So what is the structure of the blood flow? So the blood flow from the artery, and from the artery it goes into the white pulp, that is WBC layer, that is the T cell layers, and then it goes into the red pulp, and then via the red pulp the blood flows into the vein, that is a pulp vein. So first is the artery, then the white pulp, then the red pulp, and the last one is the veins. So in the spleen there are two kind of circulation: the open circulation and the closed circulation. Open circulation is the one in which the blood leave the vessel first and then they re-enter the sinusoids, whereas the closed circulation is when the blood stay inside the vessels. So there are some anatomical features that we need to remember about the spleen, that is 9, 10, 11 ribs, that where the spleen is present. 9, 10, 11 spleen is heaven, that can be remembered. And then if there is any left side hit, always we think about the spleen split. And without a spleen you lose ICC. That means that if the patient do not have a spleen or he has undergo splenectomy, then the IgM will be decreased, the complement will be decreased, and C3b opsonization will be decreased. That can be remembered by the mnemonic ICC. And a patient will be prone to some infections, that can be remembered by the mnemonic SHIN. Some nasty hibiscus, some is for Streptococcus pneumoniae, N is for Neisseria meningitis, and hibiscus is for the Haemophilus influenzae. So in case of splenectomy, there are certain characteristics of the cells that can be seen, that can be remembered by the mnemonic how targets throw leftovers. So Howell jowl bodies, target cells, thrombocytosis, and lymphocytosis can be seen in cases of splenectomy patients. So after the spleen, the next immune organ is the thymus, and thymus is actually the training school for the T cells, as we discussed in the yesterday video. So T cells actually grow up here, and it is actually a tiny T cell school that is present at the top of the chest. You can remember in the interior superior mediastinum, so it is present at the top of the chest in the mediastinum region. Thymus has the cortex and the medulla, unlike the spleen which has the pulp, whereas the lymph node has the cortex, precortex, and medulla. In the cortex of the thymus, it's usually the immature T cells are present in the cortex, and the medulla, mature T cells are present in the medulla. So if we talk about the one unique structure of the thymus, that is the Hassel corpuscle. Hassel corpuscle actually is present in the medulla, where there are mature T cell. And which pouch is responsible for building the thymus? That is the third pouch that builds the T house. There is epithelium. Epithelium is built by the endoderm, and mesoderm build the T cells. Then the next thing is the normal newborn thymus. It looks like a sail shaped on chest x-ray, and it involvates by the age of 3 years. So normally it is present in the cell shape in the chest x-ray and involutes by the age of 3 years. And then we talk about the thymus that is involate by the age of 3 years, that we remember by the mnemonic fades. So there's replacement, fatty replacement, and then there's atrophy after puberty. Then there's decline in the naive T cells, that is decrease in the interleukin-10 and thymopoietin. And then elderly have weakened immunity, patch reversible with decreased cortisol, decreased vaccine response. And S is for the decrease in size, that is decrease in cellularity and decrease in function. So there is no thymus, there is no T cell, no thymic shadow. In Diegose syndrome, there will be severe combined immunodeficiency, no thymus and no T cells. So there will be no thymus, no T cells. There will be no thymic shadow in Diegose syndrome, and there will be severe combined immunodeficiency. The 4 M's of thymoma is actually the muscle is going to be weak, that is the myasthenia gravis, and then mediastinal block and missing red cells and missing immunity. So muscle weakness can occur in myasthenia gravis, and mediastinal block is seen in mediastinal mass causing the superior vena cava obstruction, and the missing red blood cells, that is the pure red cell aplasias that can occur in thymoma. And then Good syndrome, that is the missing immunity. So this was all about the thymus, the important things are thymoma and what happens when the thymus fades. And if there is no thymus, there will be no T cells, and there are 2 things in which there is the no thymic shadow, that is the Diegose syndrome and severe combined immunodeficiency. And thymus is derived from the 3rd pouch, and it involutes at the age of 3 years. So the next topic in the first aid in immunology topic is the innate versus the adaptive immunity. So if we talk about the differences between the innate and the adaptive immunity, so the innate immunity is actually the instant immunity, and you can remember by 3 N's, that is now, non-specific, and no memory. So now is actually the fast, non-specific is minutes to hours, and then there is no memory, that is the no memory. Never let monkeys eat bananas. So what is that? Never let monkeys eat bananas. So never let monkeys eat bananas is actually the innate immunity is by the cells, neutrophils. L is for the lymphoid cells, macrophages, epithelial barriers, and the blood proteins. So never let monkeys eat bananas are actually the these 6 things: neutrophil, lymphoids, macrophages, epithelial, and blood proteins. And then born ready is mean they are germ line encoded, you're born with it, and there is no rearrangements. So LCCD, that is a lysozyme, complement, CRP, cytokines, and defensins. These are the ones that are composed of the innate immunity. So there are threat level recognition, so we're going to talk about this later. So adaptive immunity can be remembered by the mnemonic ADAPT. A is for the antigen specific, D is for delayed, that is first time, A is for the antibody production, P is for protection is a long term, and T is for T cell and a beta cell base. So B and T cell are better targeting. B cell is for the antibodies, T cells is for the killing and for the regulation. And VDJ sequence is actually a very diverse jigsaw, huge diversity. It developed during the lymphocyte maturation. Immune cell weapons are actually the immunoglobulins and cytokines. Immune cells weapons are actually the immunoglobulins and cytokines. And then the threat level recognition is actually the recognized by PAMPs and DAMPs or PAMPs. PAMPs actually are the let's fight now. So that is the LPS, that is gram-negative bacteria, flagellin, and nucleic acid, that is let's fight nows are PMPs. And mitochondria hurt humans. That is a mnemonic for DMPs. There is a mitochondrial DNA, histones, and heat shock proteins. So they are the ones that recognize PMPs and DMPs. So this was all about the innate and the adaptive immunity. We are going to talk further about immunology in the next video. Thank you for watching.